I'm Stephen Pantelakos of Fayetteville Otolaryngology Head and Neck Surgery. I've been a practicing physician at this institution for the past 27 years. Today I'm going to briefly talk about balloon sinuplasty. Balloon sinuplasty is the most recent innovation in our field. It involves advancing a catheter into the sinuses, dilating the catheter, and withdrawing the catheter. This allows us to open a sinus in the office under topical anesthesia with or without mild sedation, instead of having to go to the operating room and perform surgeries. The balloon allows us to open a sinus so that it can ventilate, so that fresh air can get into a sinus, so that it becomes an open space and not a stagnant, non-ventilated space. By doing this, we have been able to keep people from the operating room. We've reduced the numbers of sinus infections that people get in a year. They are able to return to work the next day. There's minimal downtime. There's minimal need for post-operative pain meds. And in general, it's well tolerated and people are satisfied and happy. And if you talk to them down the road, they will tell you they've had fewer sinus infections. Many of them have fewer sinus headaches, many fewer visits to the doctor, and in general, they're just happier people. The procedure itself may take a few minutes. It may be longer if somebody's got difficult anatomy, but in general, somewhere between 30 minutes and an hour and a half. Post-operative care is minimal. We want people to irrigate their nose with saline nasal spray. We don't want them sneezing or blowing their nose or lifting heavy things, and just take it easy for 48 hours. We may or may not start someone on an antibiotic and or steroid dose pack, depending on the circumstances that were encountered during the procedure. In general, it's a nice, straightforward procedure. Patient's awake, conversive with the doctor during the whole thing, and tolerated exceedingly well and able to return to their daily activities soon thereafter. During balloon sinuplasty, the first thing that occurs is we spray decongestant nasal spray, followed by a decongestant anesthetic nasal spray into your nose. This opens the nose and allows more room for us to work. After that, a topical gel anesthetic is applied to the nose, and then scopes are introduced and we start looking around. Following this, the balloon is directed toward the sinus that we are going to address at that particular time. The guide wire is advanced, the balloon is advanced and then engaged, and as soon as it is engaged, it is then withdrawn after only a few seconds, and then we move to the next sinus. During this entire time, the patient is awake, conversive, letting us know if it's being tolerated well or not. And if it is not, we apply a little bit more anesthetic so that it is comfortable. In general, the patients are, I think, very much at ease and able to experience, watch the entire thing being performed on a monitor, and if there's an issue, able to talk to the doc. The balloon sinuplasty recovery is very straightforward and simple. The only thing that we ask you not to do is blow your nose or lift excessive weight for 48 hours. The other thing that we ask you to do is use saline nasal rinses liberally. There might be some old blood or mucus in your nose that we don't want to accumulate, and we want you to rinse it and keep it clean. You may or may not be started on an antibiotic and or steroid nasal spray, depending on your individual circumstances at the time. So no lifting, no straining, take it easy for 48 hours. You can return to work the following day Rarely would you ever be put on any kind of narcotic pain medicine. Typically Tylenol and or Motrin is all that is needed for postoperative discomfort if it is present. Other than that, resume your normal daily activities. In general, the comments following balloon sinuplasty are positive. The vast majority of people will tell you that it wasn't as bad as I thought it was going to be. Many folks tolerated exceedingly well with no issues. Post-operatively, people's comments include, my headaches are gone, I can breathe better through my nose, I haven't been sick like I used to get sick. So I'm a fan. I have seen this develop over the course of the last 6 to 8 years. Initially, we were skeptics to begin with, but as we've done more and more of these, it's definitely a good procedure. It is well tolerated by the patients, and in general, I think people are overwhelmingly happy and glad that they've done it when their sinus problems resolve, disappear, improve, whichever term you want to use. If somebody's anxious, we are able to sedate them if needed prior to the procedure, but in general, I don't think it's necessary for most patients. And in extreme circumstances, if somebody feels like I just can't do this in the office, we are able to go to the operating room and do it, but that's rare. Overwhelming majority of people tolerate this exceedingly well in the office, in the exam chair, awake, alert, talking to me as I'm talking to them. We go as fast or as slow as the circumstances dictate and try to make the patient as comfortable as we can. If you are interested in learning more about balloon sinuplasty, call our office and or make an appointment. We'll be glad to sit down and discuss it. You may also go to our new website at fayent.com and learn about balloon sinuplasty there. In discussing in person, I think we can give you a true assessment of your situation and really answer the questions that you may have regarding balloon sinuplasty. Each person has individual needs. Each person's situation will be somewhat different based on their history, their CT scan findings, their nasal anatomy. But in general, we can give you a pretty good idea of what it would be like to undergo such a procedure. And are you a candidate? It's not for everyone, and we don't try to do this for everyone. Only the appropriate situations are going to be candidates for balloon sinuplasty. So we'll be glad to discuss with you and answer all your questions.